Hi, I wanted to make a video and talk a little bit about what I think is probably, after all these years, probably still the most misunderstood concept about multiplicity. And since the name of the channel is The Misunderstanding of Multiplicity, and it's been asked by several different people, explain what you're saying when you say multiplicity is misunderstood. Or what I wanted to say is, one, a shout out to TwinStar9. I have added you as a contact so you can PM me. And two, I have written extensively, and several members in this group have written several articles about the misunderstanding of multiplicity in our own experience. However, I truly believe that even as a group, collaboratively, we speak better than write. And if you know if you've ever read any of our writing together, even that you know that I think we communicate better in blogs than writing. So I will speak to that about what is the biggest falsehood misunderstanding by giving a couple of examples, because one of the status quos of this channel has always been to give a clear example where I can, where anybody can that's doing a video. So it's just kind of like the Mosaic creed, give some examples. Okay, so long ago, I walked into a therapist's office and I was diagnosed with multiple personality back in 1986. And I worked very hard with the group I was with to integrate. And I worked very hard on dealing with my past and what could have caused us all to be born and exist. But probably nobody really knows if all of us came from trauma. Although psychiatry at the time believed that it had to be a specific kind of trauma that made all alters be created or multiple personality, there was a large group of therapists that never believed in this. They didn't assign trauma to multiple personality. And there were a lot of multiples that never assigned their multiplicity to a traumatic event. They always knew that they existed with more than one, and they functioned well, and they struggled to sometimes be in society as it were multiple or living plurally and to each gain understanding from others, but that's about where they're suffering at. It just, being thought of as an alternative lifestyle for some of these people was a problem because it wasn't an alternative they chose, it was just always as they were. So long ago, when I was in therapy, 1986, a lot of people were being diagnosed with multiple personality, and I wanted to make sure I wasn't one of those people that were just being slapped a little waste paper basket diagnosis that was convenient. And after all the evaluations and the testings and going for second and third and fourth opinions and everything, it came back I was multiple. And I didn't want to accept it. I really didn't. Even though in my heart, I knew I was. I knew that some of this I could relate to, that all my life it made sense. I could look at things and say, oh, that makes sense. And now I know why. Yeah. But then there were things that I applied meaning to that never made any sense. And I applied meaning to them because it was in the psychiatrist's handbook that, this is why you're doing this and that. And you had to learn about why you were the way you were. It was part of therapy back then. But one of the most important empowering parts of therapy was when I found a therapist who didn't just keep going over the same ground over and over and over again, just got down to the nitty-gritty, and one day Tony was talking and said something very significant, very important, and it hurt to hear it. And Tony is another member in this group, and she was talking. I was talking to him 1 minute, and all of a sudden Tony was talking to him, and I heard it, and it was the first time that I couldn't hide that I heard it. It was like, when a nano expression comes over your face and you know you've been found out. It was like, that's what it was like. It was like, I heard that. And leaned forward and he said, Maria? And the way he had the question mark in his voice, I could have done the dance. I could have said, no, I'm so-and-so, and come up with a whole other personality, because I could have said, I don't want to deal with that, I didn't hear it. But instead I said, yeah. I said, did you hear what Tony just said? Did you hear the importance of her words? Did you hear what she just said? I said, yeah. So it's really important that you acknowledge what she just said. Can you do that? And I said, okay, blah, blah, blah. He said, no, not to me. I want you to let Tony know. And I thought, you want me to talk to Tony? Yeah, go ahead. Talk to Tony. Okay, now I really think this is so good. I should have just pretended I didn't hear it, like somebody farted in the room and I don't know who it is, that kind of thing, I spoke to Tony. And interestingly, Tony spoke right back. And this inner dialogue went right back and forth. And it continued. And we began to be empowered to speak to one another. And the rest of the Mosaics kind of followed our lead. And sometimes we would be like the moms of the Mosaics, where we would have to remind people, talk together. This doesn't have to be brought to therapy. We don't need to make an appointment for this. We can double check when we see our therapist. This doesn't require a phone call or a tattletale. I'm going to call and let's work this out. And we began to co-communicate together. Sadly, though, there's this pervasive thought out here on the internet with people trying to bring awareness to their experience of being multiple, or living with more than one, or experiencing their life with more than one, or being diagnosed with DID or MPD of the past, now called DID. There's this prevalent thought that keeps showing up on threads that I find so sad, because it's so it shuts down progress of health. I see the wheels of progression going forward, and then the wheels stop. They come screeching to a halt. And I've been just sitting back watching. Because when I first came out here, I was pretty steady with coming out here, sharing a lot, and there were only 3 other people that were out here kind of semi-consistent sharing. And now there's a whole bunch of people that are out here sharing their experience, and especially a lot of young people. And a lot of people that never got really good therapy, that are older, and a lot of people that never accepted what they were misdiagnosed over and over again, in and out of hospitals, and lost a lot of their life to a diagnosis that had such controversy. And now they're out here trying to share their experience and share each other with the world. And they're met with not strangers that come along on a thread and say, point the finger and judge, but other multiples. Some examples. I remember when Tommy Jameson, formerly Sidious 3, came out with the Mimi and Beth show, the Beth and Mimi show, which was two people in a group that it was really a creative way of, they know how to do software editing, and they were creatively trying to do a back and forth chit chat and show how inner dialogue is, and it can be humorous and it can be fun. It doesn't have to be awful. And it can also look at serious topics in a way that is comfortable. And some people were like, oh man, that's so cool. And other people were like, yeah, what do you mean, show and tell? Is this theater? And a lot of multiples went behind and said, oh, if they can plan to do that back and forth, they're not really multiple. Voluntary switching. Same thing happened when a group called Our Peanut Gallery, Christy, said, you know, so-and-so was going to come out and do a video about this or that. And I don't know, maybe so-and-so will make an appearance, and then they labeled their video, so-and-so might make an appearance and switch or transition, and so a bunch of people ran to the video to watch a transition, and then multiples came along and said, come on, that's role playing. You can't voluntarily just plan to have somebody else do a video. Same thing happened to Multiplicity and me, formerly Infinite Minds, who are third-year psychology clinicians at Bangor's University, graduates, or fourth year, I'm sorry, graduates, who did a big presentation on DID, who were diagnosed DID in the UK, and are doing great things for awareness, who came out and I believe it was Eddie wanted to do a blog, and Jake and Ali, and while most people were positive about it, a few multiples came along and said, oh, come on, it's just role play. It's just role play. You just know how to do different characters, you just know how to, you want to be an actor. And then in the Observer.com, when a few multiple groups got together and did an article under first person plural, me and you, and the many, 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 many faces of internet multiples under Beta Beat, the lowdown on high tech, when J.C. Clatch and Argeia and Iris from Australia did this interview, they noted that a member of J.C. Clatch's group voluntarily transitioned, and then another member was aware of everything that took place. And Dr. Richard Baer, who wrote Switching Time and claims notoriety for helping his patient gain integration, said, oh, no. If a person doesn't dissociate without complete amnesia, and if they can plan back and forth, it's not an alternative lifestyle like that. You can't plan to switch. Really? See, this is the problem. Because when you go to a therapist, that is exactly what they teach you to do. They teach you to inner dialogue. They teach you to switch. They give permission for others to come out and talk to each other and to them. But what so many people are used to seeing is therapy-assisted switches. Therapists with their clients and patients on talk shows helping bring out another and then saying, okay, it's okay for you to leave now. Thank you for coming out. That's the biggest misunderstanding. We really do all have the power to intercommunicate and dialogue, and that would be the biggest misunderstanding. Thank you.